All right, guys, let's work on opening up your hip. This is going to stretch out your hip flexors in the front of your leg, as well as your quad. 95% of us or more, we have tight hip flexors. We're sitting all day. We're doing a lot of motion up in front of us, coming forward, not much motion going back. If we are, it's tending to come from our low back. We're targeting specific muscles with this, one being our psoas major. It attaches to our spine and our low back, and then down to the front of our leg bone, our femur here. So you can imagine if that muscle is tight, what it's going to do is it's going to arch your low back, tilt your pelvis forward, and all of us, we tend to get stuck in this position that causes low back pain, hip pain, knee pain, right? There's another muscle, so psoas major coming from the low back meets up with another muscle on the inside of our pelvis. That's called iliacus, right? Those two muscles have a common tendon. They attach at the same spot on our leg bone, our femur here, and when they're tight, it pulls us into an overextended low back, lumbar, and an anteriorly rotated pelvic tilt. We don't want that. We want to get out of that, so let's open up the front of your hip. To do this, you're going to need a band here, a thicker band. Hip joint is a solid joint, so you need a thicker band. Anchor it to a rig, a desk, a porch post, something nice and solid. Put a pad down here because you're going to be kneeling. You don't want to exacerbate any knee pain you have or any knee pain you didn't have in the first place, okay? So if I'm going to stretch my right leg, I'm going to put my right leg through this band, slide that band right up underneath my butt cheek. I'm going to start with my left foot in front, right leg behind me. Get that band soft and up against my butt there, firm there. Step back to get some tension on it. You're going to kneel down on that band. So we're in this half kneel, this lunge position, right? First thing, as with most of our techniques, we want to tighten our core, flatten our back. So take a deep breath in, breathe out. Tighten your core, flatten your back, depress your rib cage. Nice flat back here. Keeping that core tight, then we want to squeeze this butt cheek on the side we're kneeling on. Squeeze that butt cheek. That's going to drive our pelvis and our hips forward. Already I'm feeling a pull right in the front of my hip where you want to be feeling it, okay? So you're going to stay in this position 1 to 2 minutes. As you go through this, you're going to be able to drive that hip farther and farther forward, getting more of that hip extension, more length in your hip flexors. Okay, if you get to the point where you have good motion, you're not getting enough stretch, you can do a couple things. One is you can take the arm on the same side, put it behind your head, keep your core tight still, firing that butt cheek, and you're going to lean away. You're going to really open up that side, okay? If that doesn't do it for you, you can change the angle of the pull, right? So turn your foot out. Maybe here you'll get more of a pull down, the front outside part of your leg. You can turn your foot in. Get a pull more down the front inside of your leg. Okay, so play around with that angle. Again, when you go through this, I recommend do it 1 to 2 minutes each side. It's going to seem like forever, but you're going to get a lot of range of motion, a lot of relief for that low back, knee, and hip pain that you may be having. Give it a shot.